Welcome to Module 3, Managing Chronic Illness and Pain, K&H 329. Basically, we're really getting into the brunt of the course. For example, in terms of chronic illness and pain, you could spend a whole semester on each of these topics, but they do fit into the health psychology framework. In this lecture, I'm going to try to really give the highlights, so you can go back into these notes at any time and look through them, especially like for the quiz and so forth, because there's a lot here. So I'll try to cover the highlights. I may not cover everything that you see on the screen. As far as the outcomes we really want from this, there's two from those two bulleted points. Define and describe the role of quality of life, its components, and the role quality of life plays in the lives of people living and coping with chronic illness. That's the first part. And then the second part, which will be another lecture or two, in terms of the essential elements of pain as a biopsychosocial experience. We keep coming back to this theme of holistic focusing, right, in terms of biopsychosocial, which is more holistic than biomedical. Now we're getting into quality of life, which is really very much a holistic idea. The idea of pain, we sometimes think of pain as being physical, but the literature and the experiences clearly show that pain is very much a biopsychosocial experience, very much influenced by the social and physical context that you're in. So why focus on chronic illness? Many of you are going into professions where this is what you're going to be doing. The data is very strong. About 50% have has a chronic condition. Focusing on older adults, 91% have at least one condition, 73% have two or more conditions. Young people have chronic conditions. For years I've taught this course, and students continually write papers and so forth that focus on various immune conditions that they have in terms of a variety of areas of life. So, and some of these conditions can be mild all the way to very severe. So chronic illness is not just reserved for, the older adult. Anyone can have a chronic illness, and just keep that in mind. Aspects of quality of life in chronic illness. Psychosocial emotional elements of chronic conditions have really only recently been considered as relevant. No surprise, right? Again, if you go back to biomedical, focused on physical, didn't really focus on psychological or social or emotional factors. In fact, physicians were encouraged not to really focus in on those elements of human existence as to bias diagnosis and things like that. And also, chronic conditions can disrupt every aspect of a person's life in his or her family. You're talking about physical intimacy, willing to be social, psychological aspects such as depression, for example. And you don't have to look any farther than Venus Williams and myself, because what do we have in common? Good old Venus. If you know Venus Williams, professional tennis player, right? That's me on the left, Venus Williams on the right, and we have two things in common. One, we both like athletics. I actually like tennis as well. Venus is obviously much better than me at that, but what else do we have in common? Well, guess what? We both have this thing called Sjogren's syndrome, which is an autoimmune condition that attacks our healthy tissues, unfortunately. And so I don't want to make too much of this, but I was diagnosed about 4 years ago. I had probably had symptoms for about 2 or 3 years before that, so it was kind of funky. So again, look around in your own family, cousins, aunts, uncles, grandparents. Someone has some kind of chronic condition probably, and you yourself may even have a chronic condition that maybe you'll share with us in this class in some way, shape, or form. So again, with Sjogren's, no one's ever really heard of it outside of people who have Sjogren's, but there's about 4 million people who have it. And it affected Venus. She had to withdraw from the US Open a few years ago, and her game really never came back. I give her credit because she's out there trying. I'm out there trying. People with chronic conditions typically want to have a quote-unquote normal life. And so you'll be working with a lot of people, whether it's in physical therapy or physician assistant or occupational therapy, where people are coming to you with either acute or chronic conditions. And you can't just look at the physical element of those conditions. So anyway, chronic conditions are related to depression, anxiety, stress, emotional disorders. We'll get into a little bit more of that when we get into stress and flourishing health in Section 5 or Module 5. So what is quality of life? No surprise. Quality of life, you have to look at it from a biopsychosocial perspective. Hopefully not getting too repetitive, but there's multiple components of quality of life. You can go into reading 6 and take a look at it in terms of physical functioning, psychological status, social functioning, and then of course disease or treatment related symptoms, and all of those relate very much in line with biopsychosocial perspectives. Now, as far as just looking at, this is a figure from reading number 6. If you look at just the general population and all of these different varieties of life, right, physical functioning all the way through to mental health, this is kind of just in terms of typical scores for quote-unquote non-diseased populations. Now look at people who have depression or migraines or hypertension or osteoarthritis or type 2 diabetes. The scores invariably, although they're not disastrous in some ways, they're almost all lower than the general population. So if you have a chronic condition, you're typically not firing on all cylinders, and you have to understand this if you're working with individuals, or even if you're trying to be a caregiver, or you have a spouse that has a chronic condition such as an autoimmune condition. They are not going to be at the same level of vitality or the same level of social functioning or emotional well-being. They'll have more pain. I mean, look at people who have migraines, very low quality of life overall in terms of typical scores on some of these kinds of measures. So point being, with this kind of figure or table, you can see and hopefully appreciate that people with chronic conditions are not going to have the same opportunities to flourish, although they may in their own way, but it won't be the way in which non-diseased person or a person who doesn't have a chronic condition can function. So just something to keep in mind as we go through this. So quality of life measures can pinpoint connections between certain diseases and key psychosocial markers. So it's good to have measures of quality of life. So you're working in clinical settings, you might want to see, or if you're shadowing someone, do they get an assessment of more than just the physical malady or the physical condition? So quality of life, very important to measure. You can assess impact of treatment protocols. You can compare how different therapies impact quality of life. Different types of, for example, chemo may impact quality of life, and people have to make decisions about how they want to approach these kinds of things. Now, in a good way, doctors and healthcare providers are kind of beginning to get the idea. As you see here on the screen, this is just one sample of a quick snapshot or a quick assessment that you could take in a doctor's office or in a healthcare environment in terms of asking patients or clients about how they're feeling in terms of mood or social interactions. This is only relatively recent, keep in mind. In terms of, again, because of the dominance of the biomedical model, there was very little focus on the social, emotional, psychological dynamics of illness. But clinicians are beginning to get it. They're asking people about emotional issues. They're asking people about energy, depression. Again, these aren't like clinical assessments, but just kind of snapshot types of ways. So there is hope on the horizon in terms of people looking at a more holistic way of understanding and treating chronic illness. All right, as far as emotional responses to chronic illness, we typically have denial, anxiety, and depression. You need to be on the lookout for these if you're working in clinical environments in terms of some people want to deny that they don't have if it's a chronic condition, they deny it, or they may exhibit a lot of stress or anxiety and fear about the unknown. And many individuals who have chronic conditions, they typically will have depression. Sometimes it can be a delayed reaction. This is very significant because, again, as you saw earlier in that figure, people with depression can have a low quality of life. Suicide chances increase. People don't like to talk about these things, but it's true. So you got to make sure you get in there and really kind of get a feel for how your patients or clients are doing in terms of emotional, mental, psychological, social well-being. Even they're beginning to do routine screenings for all chronically ill patients as it relates to depression. So these emotional responses are important because they do impact well-being, they do impact behavior. For example, if you're in denial, you may not go about getting the right treatment, you may not take your medications, and so forth. So there's a lot more that goes into this than this treating a physical condition. A lot of significant issues with chronic illness and injury. I've experienced some of these throughout the last few years. Again, I'm not special or unique in that way. People who have chronic illness or injury, they have a lot of issues relating to physical problems, obviously. Chronic fatigue syndrome. If you're not feeling good, you may not feel like having sex. This can influence the intimacy of relationships. People don't often adhere to physical regimens and treatment. Behavior change becomes a significant challenge for people with chronic illness. They may not have the energy to exercise, for example, and vocational issues are very significant. Vocational issues as far as employees, for example, with cancer, are fired or laid off 5 times as often as other workers. Lots going on here in terms of work. They may go on disability, and of course if you go on disability, yes, you get income, but it's certainly not the same in terms of what you might have been making if you weren't on disability. So physical problems, somatic syndromes, sexuality, lack of adherence, vocational issues, all very significant. And then social issues, changes, dynamics of social interactions. Family members become caregivers, and they are now at risk for illness. This is very significant. You may have had a parent who may have been had to take care of a grandparent, for example, or a cousin. Very challenging. The problem, of course, is that caregivers doing what they're supposed to do, of course, with loved ones, they then put themselves at risk for developing chronic conditions. And the one study, the National Alliance of Caregiving study, found that it can be easy, experts say, for caregivers to forget about their own well-being. So now you got a caregiver taking care of a sick relative, for example, or someone with a chronic condition, and now they're at greater risk for developing various conditions, and they typically don't take care of themselves. They typically cost more in terms of healthcare costs than non-caregivers. So caregiving is something that you really have to keep in mind as you're working with families or families with someone who has a chronic conditions, in terms of don't forget about the caregivers, because they're also at very high risk. So that's something to think about in terms of caregiving. Some amounts are staggering from that study. Workers who are caregivers cost their employers an estimated 8% more in healthcare costs, potentially amounting to an additional $13.4 billion. So caregiving, very important in terms of have to do it, but it also can create health problems in those who are the caregivers. And then another significant issue relating to chronic illness is chronic illness, injury, and the self. And there's really 4 main areas, and I can attest to having this has impacted me with Sjogren's in all aspects of my life. And I'll stop here and we'll come back and we'll get into a little bit more on these 4 different areas, as well as the positive side of chronic illness, and then we'll move into pain.